Is it okay with you if I do this exam?
Yeah.
All right. So, do you have a latex allergy?
No.
And I'm inspecting her head and skull. And her skull is normocephalic. And I am inspecting the scalp. And the scalp is intact. There's dryness. And I'm lifting the hair and I don't see any lesions. Okay? And if you could smile for me and frown and puff out your cheeks for me. Okay? So cranial nerve number 5, facial nerve is, or 7, facial nerve is intact. As she was able to perform the activities I asked of her. Okay, so I'm now going to touch your face, okay, and so her temporal artery is a +1 out of 4 on the left and a +2 on the right. And could you open and close your jaw for me? Okay, and her jaw opens smoothly and closes without crepitus, and that means the temporal mandibular joint is intact. Okay, so I'm going to touch your sinuses. Please let me know if you have any pain. Okay, so I'm palpating first. Was there any pain?
Nope.
Okay, and I'm just going to tap lightly. Any pain?
No.
Okay. So her frontal and her maxillary sinuses are not pain-filled, as she denied pain, and I did not palpate any edema. Alrighty, so I'm going to ask you to close your eyes.
Okay.
All right, and can you just point when you feel this?
Like that?
Yeah, point to where you feel it.
Oh, okay.
Yeah. Okay, and so the trigeminal nerve, that is cranial nerve 5, sensory, is intact as the patient was able to identify light touch in 3 areas on the face. Okay, so I'm moving on to the eyes. The eyes, I do not see any erythema, ptosis, or edema, and there is no lesions. The cornea, the sclera is white, and the cornea is clear and not clouded. The iris is round and a gray-green, hazel-y kind of combination. Interesting combination of eye. Yeah. And it is round. And if you could follow my pen light, okay? So if you could don't move your face, just keep your nose pointed straight at me, but just follow with your eyes. All right. So she was able to follow the pen light without nystagmus or jerking so smoothly. So therefore, I know that her ocular motor and optic nerves are intact, which are cranial nerves 2 and 3.
Right.
Could you do me a favor and pull down on your eyelid? Okay. And her conjunctiva is pink And there is no erythema or lesions. All right, you can let that go. Great. All right, so if you could cover one eye for me, please. All right, and stare straight ahead and let me know when you see my pen.
No.
Okay, and so for her temporal on her right eye, that is 90 degrees. And tell me when you see my pen.
No.
Okay, so superior on the right eye, that is about 50 degrees. And can you tell me when you see this?
No.
Okay, and inferior, that's about 45 degrees. And nasal.
No.
All right. And that was about 30 degrees. All right. And could you swap the other hand? All right. You can go ahead and blink away that pressure. All right. Stare straight ahead. All right. And tell me when you see my pen light.
No.
Okay. So that is 90 degrees on the temporal on the left side. And tell me when.
No.
Okay. And that was about 45 degrees on the nasal. And
no.
About 50 degrees on the superior.
No.
Okay. And about 60 degrees on the inferior. All right. So therefore, I know cranial nerve number 2, optic nerve. You can put your hand down. Thank you so much. Cranial nerve number 2, optic nerve is intact, as peripheral vision fields are intact. Okay. So I'm going to shine a light at your nose. Could you stare straight ahead at my nose? Okay. And the light is reflecting evenly in each eye. The shiny bit is in the same spot. Therefore, I know that the corneal light reflex is intact. Okay, I'm now going to check for Perla. So her pupils are equal. They are round. They both consensually and directly react to light. Now, if you could stare out that window for me.
Okay.
And focus on my pen light. All right, and her pupils constricted on the near object, which tells me that her the pupils are equal, round, reactive to light, and they accommodate, which means that her cranial nerves 2 and 3, the optical and ocular motor, are intact.